everyone. Today we are here with Dr. Reddy, an internal medicine doctor who is has had a lot of experience in medicine, and we're really excited to be here with you today and ask you a couple questions.
Okay, thank you. Hi, how is everybody?
Okay, first question, Dr.
Good.
Reddy.
Okay.
What inspired you to pursue a career in medicine?
So I come from a family of physicians, and that obviously I grew up with medicine around me. I also was first generation of my parents who came here in 1964. So being of Indian descent, it was either I was going to be a doctor or a doctor, and those were the only options. Um, so that definitely played a role in my decision making process.
Yeah, I think like that the culture is really important for like a lot of decisions. I think it's like it definitely has an impact on me, it has an impact on a lot of people I know. So I think it's still there for sure.
Yeah,
um,
plays a role.
yep. But what does a day in your life as a doctor look like?
So it's definitely very helpful to be a multitasker. I start early in the morning. Things have changed over time because I work various different parts of medicine. I work in the clinical side, which is the hospital setting. I work for a community clinic, and then I work in an administrative side. So they're all very, very different. The clinical side starts early in the morning, and then it goes through the day, pretty much 24 hours a day, because I'm not in a large group that covers each other. So being in a group practice takes more control of your schedule, so you don't have to be on 24 hours a day. For clinic, those are set times, so that's easy. That's what when clinic starts and when clinic ends. And then administratively is the easiest because I can just do remote meetings and be sitting in my pajamas and do what I need to do. So I've gotten a taste of all three versions, but my typical day is getting up early in the morning and just keep going until the next day.
One question. Which part is your favorite? The clinical, the administrative?
So I love being a clinician.
Mhm.
I really enjoy it. Uh, but as I've gotten older, I like the administrative part because it's more flexible and it's remote. I think the combination of both is really important because I can see the clinical side of things, but then I can also see how it costs and what the impact is from a financial standpoint and why some decisions don't match with each other. And so I think my clinical experience is really helping me in my administrative side. So, but as I get older, I think I like administration more. But I don't think I could do it such a good job in administration if I didn't know clinical as well.
Mhm. What has been the most rewarding part of your career so far?
Making people's lives better. It sounds very cliche, but like literally, I have been able to take someone. I'm an HIV specialist, so I can take someone who is literally at death's door and turn their life around with just treatment and meds and nurturing their care, and that's extremely satisfying. I have patients who have been with me for 25 years. That's quite rewarding that they trust me their whole life to take care of them. And I love when I can solve a diagnosis or figure something out that's difficult or not easy to see. I really enjoy doing that.
I was wondering what specifically like motivated you to focus specifically on like HIV.
Well, I started in HIV when it first became like kind of an epidemic proportion as a fellow. And so at that point, we were just scrambling to keep people alive. We if we could keep them alive, we were happy. And that was really, really hard to do. And
Mhm.
now, fast forwarding 35, 40 years later, we're using one pill a day and giving people a long, normal life. Um, I mean, I've had people with zero T cells who are now in relationships and normal T cells, and they were fading away and scrawny, and now I'm telling them they're too fat and they need to lose weight. So they have the normal problems of life rather than facing death. So I've seen a lot. I mean, I've been through the HIV epidemic and then COVID. So that's two different outbreaks that I've been through, and quite intense in their own separate ways.
Yeah, they both had such a big impact. It's like,
Huge,
um,
yes.
yeah, exactly. What are some challenges that people may not realize, like doctors such as yourself face?
Well, people have good days and bad days. So we have a tendency to be a punching bag for patients. Everything that goes wrong, from the insurance not paying their bill, to the nurse not listening to them, to not feeling good, to having problems in life, we are the target of all their frustration, which is quite challenging, because we're human as well. So you have to be able to control yourself and not react. And sometimes that's really, really hard. Lately, it's gotten worse. Entitlement is a huge component of people's personalities. And so, everybody's owed what you do for them. There's no saying thank you. I mean, I've probably heard 5 times in my career, "How are you doing, Dr. Reddy?" So I get taken aback because people don't remember that we're also human beings, and we have feelings and we have lives and we have families. We have bad days, we have good days. So they don't see us that way. They see us as a power to be that is just immune to everything that happens in life, and we just have to deal with their problems. So that can be quite a challenge to balance that scale.
That's a great response. You really have to be able to communicate and respond to people when they don't know what they're going to like say back to you, you know?
Yeah, and it's kind of also, life has changed where everybody wants everything right now, this minute. And so it's like, drop what you're doing and talk to me. Well, I have to take a shower. I have to eat breakfast. I have to do my normal life. But they don't see physicians that way. They just see us as always on call, 24/7, no personal life. And that can wear on you. So you have to learn to create boundaries without upsetting people. And that's been a
Why else did you choose your specialty? And what do you enjoy most about it?
I wanted to be a gastroenterologist, and I went and did a colonoscopy, got grossed out, and walked out and switched to infectious diseases. Big difference. My uncle was a well-known infectious disease doctor who was one of the first people who diagnosed HIV and management of HIV. And I see infectious diseases as a mystery. Like, you get all these pieces of the puzzle and you have to put it together and come out with a solution or figure it out, you know, um, as to what the diagnosis is. And I love that. Um, and also, we always seem to be the ones that ask the weird questions to figure out the answer. What kind of, do you have animals at home? Do all kinds of things we ask, and people are look at us like we're weird, but we have a reason behind it. And so it's always interesting. It's never boring. I don't think I've ever had a boring day at work, ever, ever, ever. I've always learned something or been surprised by something, or solved a mystery, as I put it. That's what I love the most about infectious diseases.
Yeah, I think it's really cool that there's like Sherlock Holmes esque like
Yes.
aspect to like
I would
to
have been,
being
I
this.
would have been, I would have been much more financially richer being a GI doctor. That's the one thing about ID. If you're looking to make money, it's not a money making field, but it's very satisfying and enjoyable. But if you have a procedure related medical job, you'll probably do better. But then we don't know. It depends on how things go in the future.
Hmm. Yeah, exactly. I guess it's kind of based off like just like the idea of like I guess passion over money and like whether or not you should choose money or passion. I guess like what advice would you give to high school students who are interested in medicine?
Well, my son's actually a psychiatrist now. And so, very different than what I do. And what I said to him when he was going through this was, you have to love what you do. Money is always important because it helps your lifestyle and it helps enjoy what you like to enjoy, but that's not what makes you happy. You have to really, really enjoy what you have to do. Wake up in the morning, want to go to work, want to do what you're doing, and then everything else falls into place. But if you hate your job or you hate your specialty or you really don't enjoy it, you're just there for the money, you're never going to be happy. And so you pick a field based on those things. That's why he's a psychiatrist, and I could never be a psychiatrist. I have no patience to be a psychiatrist. I couldn't listen. And he's so patient and he's so compassionate. He listens and doesn't comment. And so he picked a field that, a lot of people think, oh my God, why do you want to do psychiatry? But he's so good at it. So he found something that he liked and he was good at and enjoys and comes home feeling satisfied. And I think that's how students need to pick their field. Everybody kind of looks, oh, okay, let's see, this guy, this field makes the most amount of money. Okay, but do you like it? Do you enjoy it? Do you want to go to work? Do you want to do what you're doing? That lasts forever, right? So, and then now in medicine, it's so different because of AI and all the things that are coming into play. So I would tell students at this day and age, combine other interests with medicine. AI directed fields or things that connect to medicine with AI, so you can keep up with the times and you can find. You don't have to be a clinician or in an office to be a good doctor. You could do all kinds of different things at this point with medicine. So even if it's not direct clinical care, and you go to med school, you can always combine that degree with something else that makes you tick. You've got to love what you do. You've got to love it. And if you don't, you're never going to be happy.
That's what a lot of people say about becoming a doctor, because it's such a long path, such a long journey just to
Yes.
become a doctor. And if you don't love it along the way, then like, what's the point?
Well, I've told a lot of kids, even if you finish med school, you don't have to do residency. I mean, you can go do engineering, you can go do something in computers, you can use the medical degree to do something else that you want to do as well. And then you're not investing, half your life in residency and then being miserable about it or not being happy about it. You can definitely just use the medical degree, combine it with law, combine it with masters in public health, and then do something totally separate than clinical medicine. We need that as well in this day and age. We don't just, I mean, if computers are going to take over our thinking process, then maybe we need to do something with our medical degrees that help in the future.
Yeah, I completely agree. Yeah, I think it's like, especially recently with like all this new technology and stuff, like it's become a lot easier to like synergize two fields and kind of
Yeah.
create like such a unique specialty.
Yeah, my son did an MD MPH and then did psychiatry. But when he did his MD, I said, you can stop right here. You can do your MPH and go, do something administrative or go see what else you want to do with your MPH degree. You don't have to do a residency if you don't want to. And I think that's really important for the new generation to know. You don't have to follow the old path that we all followed. You can get medicine. And the one thing I always say to my kids is finish all your education when you're young. Get as many degrees and experiences that you can get. Then sit down, put it all together, and then figure out what you're going to do with it. And it's different than our generation where we went to med school, went to residency, followed the routine, followed the path. That's not there anymore. You have a lot more opportunities now. And you also have parents who think differently than our parents thought. Our parents were first generation, so they wanted security and safety and consistency, and that doesn't exist anymore. You can do so many other things. So you should take that.
That's about it for us.
Okay.
So thank you so much for
I hope that helped.
doing this with us. Yeah, thank you so much for
Thank you
doing this
so
with
much,
us.
Dr. Reddy.
All right, take care. Have a good weekend. Bye-bye.
Bye-bye.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.